Okay. So, do you want me to do the sharing or you will do that?
I will do it, sir.
But then,
What you are presenting, I will do it. No problem.
but the idea is I won't be able to control it, isn't it?
Okay, because
No, you'll be able to see it, sir.
yeah, yeah,
No, Abraham sir will be able to see it on the screen.
yeah, yeah.
Okay.
So,
Yes,
yeah.
you
So
can see
as your talk goes, Dr. Mangal will coordinate, sir.
yes, yes.
That shouldn't be a problem. Yeah.
Oh, okay. Okay. All right. So, because I need to see it. All right. Okay. Fine.
Yeah.
I have a printout with me, so no problem. So I can talk about
Wonderful,
it.
sir.
Fine, fine, fine.
So as I speak, depending upon the relevance, you can kind of
Yes,
Yeah.
right.
Yeah.
Okay,
Yes.
that's good. Okay, so I don't need to then worry about the presentation. Right. Okay.
Good to see you, Abraham sir.
Nice to see you, sir. I think you put on beard, a new version,
Thank you. New avatar.
new avatar. Oh no.
Yes. Thank you.
Lovely to see you.
for register to
Yeah.
join. Let us see. I will register to join.
Sure.
So
Sure.
can you see me? Okay. Is my
Yeah,
audio?
yeah.
Everything
Sir, kindly come little forward, sir. Your face is partially seen. Yeah, now it's perfect, sir.
Okay.
Now it's perfect. Just perfect. Yeah.
What about the background? There are no other objects.
No, sir. Nothing.
Okay.
I think only
Because I
that
can't see
showcase
myself.
or something.
I
Yeah, I
can't see
know. Yeah, in Google Meet platform we cannot see.
Okay. How is this now?
Yeah, it's perfect, sir. Perfect.
Okay.
No problem, sir.
Okay.
Nothing.
Good. Okay.
No problem.
You know the room, so you know it.
Yeah. Yes.
Okay. I've just quickly gone through and I didn't have enough time. So I just
I've gone through your entire PPT, sir. It's fantastic.
I didn't have enough time. Just put some
Wonderful,
things
wonderful,
together.
sir. Wonderful.
Oh, that's
These
it.
are very important thoughts worth sharing, especially
Yeah,
that curiosity approach. That's
Yeah,
really
yeah.
amazing. Yeah.
Let's see how it takes
Yeah,
over.
yeah. Sure.
Yeah, Dr. Mangaleshwaran is hearing me as well, isn't it?
Yes. He's online. Our Honorable Registrar also has joined us. Dr. Gopinath has joined us.
Oh, that's lovely. Okay.
Yeah.
So you can hear me, okay? There is no need to
Yeah.
increase
Yeah.
my
No,
volume.
your volume is okay, sir. You are audible. Good morning, Registrar, sir. Good morning.
Good morning. Yes. Welcome you all. Welcome, dear participants from India and abroad. Good morning, good afternoon, and good evening to all. It really gives me an immense pleasure in welcoming you all to the virtual platform on the 2 days international webinar on the social work interventions post-COVID situation with special reference to mental health. Indeed, we had a very nice presentations and webinar for the past 3 days. And especially we started with the social work response to COVID-19 on the mental health perspective, exclusive for the social work students 3 days back. So that was, we had a very good experience and very good exposures, and lot of students from India and abroad, they took part in the virtual platform. And with this experience, we are going ahead to organize this international webinar. I'm indeed happy welcoming our respectable registrar, Dr. Gopinath Ganapati, and the speaker of the 2 days, Dr. Abraham Francis, my own colleagues, Dr. Sanko, Dr. Jerida, Dr. Nirmala, Dr. Rajavel, and the faculty members across the globe. One small request to all the participants, kindly mute your mic. I request all the participants to kindly mute your microphone and turn off your video, please. So it will not interrupt the presenters. So thank you. Thank you for your kind cooperation. So just before going into the things, let me make a small presentation of my own department. And to start with, let me give a brief about our Bharathidasan University. It is named after a great poet, Tamil poet, Bharathidasan. And this university was established in the year 1982 with the motto of Pudiyador Ulagam Saivam. In English, we call it as we will create a brave new world. We have 37 departments offering 151 programs, including 40 PG programs. And we have about these. And you can just see the faculty members of our department, our senior faculty, Dr. Ilango, Dr. Jerida, Dr. Nirmala, Dr. N. Rajavel, and myself, Dr. R. Mangleshwaran, Professor Head. I'm just right now talking to you. And we have a very good child guidance and counseling center, which was established in 2010 under the leadership of Dr. Jerida, and we have a lot of counseling, mental health and counseling service to the parents and students, and even the fieldwork trainings being done with the students, social work students. And as you, of course, you know that these are some of the learning experiences we have with the social work department, and you know the curriculums like fieldwork, community organization, group project, block placement. And when it comes to the publications, we have so far organized 57 national and international workshops and thousands of extension program. 140 extension program is with respect to the 1 year. And the publication, we have a lot of credits to the publication, and several books have been published international and national level, and total publication comes to 458. And these are all the collaborating agencies, Department of Social Studies at University of West, Sweden, Howard University, James Cook. Right now, Dr. Abraham is from the for CD, and he can also opt for medical and psychiatry, but on the self-study basis. 5 projects are in pipeline. And village adoption, based on the project, we have adopted Manihandam block Trichy, and we have been doing a tremendous work, free medical camp, promoting health and hygiene, free tuitions and research activities. And of course, apart from this Manihandam block, we have also adopted Tiruchirappalli, which is in Trichy, where UGC has sponsored about 7 lakhs. We have work association for students that is named as Swasti. These are some of the just fieldwork, a few fieldwork agencies, and of course we have a place good 100. We have a 100% placement because even recently we had an online interview because that is the order of the day. As you know that because of this COVID-19, we have been using the virtual platform in a very better and very effective manner. So. So these are the few things which I would like, sir. And of course, we have a very good lab facility, SPSS lab, because the data that is being done using SPSS lab. So this is thank you. And this is about a brief about our profile. So I'm happy to introduce the inaugural remarks, in our, respected registrar, Gopinath Ganapati, who is right now with us. He is a very computer savvy and technically very strong. He is a man from computer science department, and he is a very dynamic personality, I would say, that along with our Honorable Vice Chancellor, Dr. Manishankar, we were able to get A+ in the 3rd cycle of the NAC. So, and even our Vice Chancellor used to say that all the faculty members has to work 24/7. So embracing that, our registrar and other faculty members are tremendously putting their efforts for the well-being of the students. And I would say that our Professor Gopinath Ganapathy is student-friendly, faculty-friendly, and non-teaching friendly, and society-friendly person. So he is also a member of syndicate in the senior most category of professor. He was a director of Technology Park BUTP, and he was a director of Institute of Entrepreneurship and Career Development. He was also heading the Department of Computer Science, coordinator of University Business Collaboration Center, and a lot of things. I can say that he has a very good publication too, and he has about 940 publications to his credit. Sir, it's over to you, sir, for your inaugural remarks on this particular international social work intervention post-COVID situation, special reference to mental health. It is over to you, sir.
Thank you, Dr. Mangaleshwaran, for your kind words. And in fact, I join hands with Dr. Mangaleshwaran in welcoming all of you to this international conference. And I'm seeing more than 104 members that are currently participating in this event. So I'm so honored to get connected with this international event, and I professionally thank the Department of Social Work for giving this wonderful opportunity to take part in this virtual engagement. As Dr. Mangaleshwaran suggested, Bharathidasan University is pioneer in many initiatives, particularly in online virtual e-learning systems. In fact, this university has started its online program as early as 2008. But a conference at the international standard, at the international scale, with international experts, that too virtually, I think this is a first quite new in the university. And for this particular endeavor, I congratulate the Department of Social Work and I salute the entire team for bringing out this wonderful, innovative endeavor. I think no university in Tamil Nadu, in any state university for that matter, has ever endeavor into that. So, with a note of appreciation, I congratulate the Department of Social Work for their new initiative. Of course, this topic is post-COVID mental health. That's a focus, very acute focus on the particular subject. I'm so glad to see the word post, because post-COVID means after COVID, technically. So I'm happy to see the word post because it indirectly tells me that the COVID pandemic is totally over. It's ending its towards the end rather. So in that sense, I'm really happy to see the word post. But our university has launched a website on mental health, particularly during the COVID-19 lockdown days. How we can cope up with, how we can take care of yourself. So for that, we have introduced a new website in April 7th itself, on April 7th itself. So it is used by faculty members, students, and parents, and many other stakeholders of this. So that's a very good website. We have already ventured into the the mental health business long ago. And this particular mental health website or portal, we have appointed two counselors. One is Dr. Manime Halai from Women's Studies and Dr. Ram Ganesh from the Department of Education and Technology. They are very good in psychological counseling. So they are appointed as counselors to deal with mental health of students and parents and other people. So we are doing business on this. I'm sure this conference focuses on post-COVID mental health. Of course, very crucial, very, very important, because mental health leads to physical health, and physical health leads to social health, and social health leads to global health. So it has become a global issue. In fact, COVID-19 is dumb and stupid organism. It doesn't know if it's Italian or Chinese or Indian or American. And this particular conference, I'm not sure we talk about mental health of who, right? Whether the COVID patients who are affected directly by the COVID, right? Are you going to focus on their mental health, or you're going to talk about the relatives, the close circle of the mental health, the COVID people, or non-victims of COVID people, right? So which one you are really focused on? So technically, so you must have a constant and an acute focus on a particular domain, so that we can, come up with a lot of research I request you to kindly, in this juncture, particularly, I request you to, not to attribute any social attributes such as ethnicity, religion, nationality, or geography to any such people, because that will lead to other issues technically. So I request all of you, the social workers, to come out with a counseling mechanism, because good words will minimize the stigma. The stigma, particularly some sort of mental health related stigma, right? So that would lead to racism. And I know a lot of people are, particularly in India. I get a lot of stories that the people are rejected, excluded, or discriminated because of this COVID virus. So, a social worker, my appeal to you, all of you, to come up with a counseling mechanism at all levels, maybe at national level or local level or even global level, so that you can, advise the government there. Because you should think about the mental health as part of the public health response. So you have to advocate and advise the government and social bodies how to deal with the issues of mental health post-COVID. So we need to create online counseling centers. One solution I'm throwing out now to your table. So we can start online counseling centers. Probably we can leverage this kind of social networks, right? So many people are using Facebook, LinkedIn, for discussion with their employees, how to deal with, how to cope with this kind of situation. So fear is a great factor that affects people in many situations in the pandemic, right? So on the historical lines, the planet Earth has seen many deadly disasters than this. But fear is a response to a situation, and now the situation is uncertain, unpredictable, unclear, unknown. So if fear rises, and then never before, that's my feeling. So you have to deal with the rumors, misinformation. The people get fear because of a lot of misinformation and rumors around. So how to deal with those kind of situation? Some people resort to tobacco. Some people resort to alcohol. That never benefits them at all. Rather, it aggravates their high risk level in their body system. So fear, anxiety, stress due to hunger, or due to financial crisis, or due to poor relationship, due to jobs. So there are many things to be addressed, in mental health. So the conference, I think, they should address the mental being of all sections of people, may it be children, or adolescents, or elders, or parents. Because children, I'm very much worried about it. I'm not sure whether I'm going to send my daughter to the school this year. This is a fear with the parents also. Many parents are so afraid. So how we can deal with the education system for the children? And they're not sure about in the schools whether they maintain social distance or not. So can we send the children to the schools? So that's one big question I'm going to the social workers, to the researchers. Also, you have to focus on the other part, the professionals, right? The employees, health workers, the laborers. So how we can come with the solutions for those kind of people. So how we should take care of their mental well-being. So how we can maintain normalcy and to go with the normal routines, daily routine. So are you suggesting yoga or physical work or any other mechanism to deal with this kind of mental well-being after COVID? So my question to you is, have you drafted any guidelines for mental health of these people? Whatever. So the bottom line is very simple.
So we are not able to get your audio. Audio is not clear, sir. We are not able to get because there is a lot of the chat box. Your audio, it seems that audio is not clear.
Okay, is it audible now?
Yeah, fine, sir. Fine.
Okay. So this conference should address the mental being of all sections of people, particularly the children, as I said, the children, adolescents, elders, parents, or the other sections, professional sections like employees, health workers, the laborers. How we can deal with those people? How we can ensure the mental well-being of those people post-COVID? So are we getting any guidance? This conference is going to draft a kind of guidance for the mental well-being for those people post-COVID. Are you suggesting any mechanisms like yoga or a physical work or social, socialization virtually? So we have to come up with a lot of things and a lot of opportunities for research in this direction. And with this random thoughts, I come out with one simple bottom line that all of us have a role to play post-COVID. And I'm sure that the conference should come out with the self-care mechanisms and procedures and self-coping strategies. So this may appeal to all of you social workers. So with these thoughts, I kickstart this event and wish you all the best. Thank you very much, Mangleshwaran and the Department of Social Work. Wish you all
Thank you very much for joining us and giving a very beautiful your inputs related to mental health. So thank you, sir. Thank you very much for your suggestion. And now let us. I'm very happy to introduce the speaker of the day, Dr. Abraham P. Francis, an associate professor and head, social work and human services, James Cook. To brief about Abraham P. Francis is an associate currently heading the Academy of Group in Social Work and Human Services at James Cook University, Australia. So Dr. Francis is a research fellow at the Department of Social Work, Stellenbosch University, South Africa, and an adjunct faculty with Prasanna School of Public Health, Mahe, Manipal. He has worked with government, non-government, and corporate sector, and has developed many international partnership. He taught social work at Delhi University in India and worked as a senior mental health social worker with Country Health, South Australia, before moving to Townsville to join James Cook University. He has extensively contributed to the literature on social work practice in mental health through his publications, convening conferences, establishing research network, and by developing consortium. His other research interests are in the field of communities, criminal justice, international social work, and gerontological social work. His excellence in teaching has been recognized on a number of occasions. For example, in 2010, he was a recipient of James Cook University Inclusive Practice Award for his exceptional support for students with disability. In 2016, he received the university citation for outstanding contribution to the students' learning for his leadership and expertise in social work education in mental health that inspires and nurtures students to be competent, confident, and compassionate practitioners. Dr. Abraham Francis, one of the finalists at the 2018 India Australia Business and Community Award in the category of Community Service Excellent Award, a Business Leader Professional of the Year. In 2018, Dr. Francis received a NAPSI Award, a lifetime achievement for his outstanding contribution to the social work education. So he's a very energetic and very enthusiastic person who can even speak for 3 hours or 4 hours with his energy. So it's over to Dr. Abraham for your an enthusiastic presentation on the topic of social work education post-COVID-19 reflections and way forward. Over to you, sir.
All right. Thank you. First of all, let me just check. Can you all hear me okay?
Yeah, okay.
Wonderful.
Yeah.
Can I make a presentation?
Yeah, just put the slides up.
Yeah. Is it okay? Are you able to see?
Yes, I can see it. Yeah.
Thank you.
All right. So, first of all, very good evening to all of you, and welcome to this presentation. I would like to thank Mr. Mangleshwaran, Professor and Head of the Department of Social Work. Dr. Mangleshwaran, thank you so much for giving me a call. And this morning, in fact, we talked about it. So thanks for being so connected with this project. And also some of my fantastic colleagues in Bharathidasan, Jarida, Rajwell, my dear friend and colleague, Professor Ilango Panuswamy. So I just want to say thank you to all of you, and my sincere gratitude and acknowledgement, for organizing such a fabulous, webinar here. Also want to acknowledge Dr. G. Gopinath, the registrar, who actually put forward some key ideas in terms of mental health. He asked us 2-3 important questions, in terms of what is the scope, how are we going to address these mental health issues? And he has also asked us Are you going to look at the self-care strategies for your students, people who are affected by this particular issue? What is the scope? How are we going to address this issue? So in general, that becomes a kind of a key direction for this webinar. And probably this question will lead us into take more proactive steps to address. So I stop there. Just want to kind of thank G. Gopinath for actually adding that value to this webinar. So I know there are a number of students, number of my colleagues, friends, the students from various colleges and universities listening to this webinar. I've just noticed some of my colleagues, even from Australia, have joined this webinar. So to all of you, I say good evening, namaste, namaskaram. Just want to say that it is such a great privilege for us to be connected together. And it is this webinar that brings us, all of us together here to talk about this particular topic. So to those students, practitioners, and all of you who are doing some amazing work in the sector, who are connected to your own communities, who are connected to your own little groups, who are really doing some interesting work in those in this current periods where we are all struggling with. I just want to thank you all, appreciate the great work that you are doing, and acknowledge the leadership that our students and our practitioners are demonstrating in this sector. It's fantastic. So thank you. Greetings from James Cook University. I really wanted to say what a great honor to be here today speaking with you. Now, as Dr. Mangaleswaran said, I like to engage with my audience, but unfortunately, I can't see any of you. I can only see a blank screen here. So I'm trying to, speak to, as if I know that all of you are sitting here. I'm just trying to engage with you all through this kind of a medium. So what I request all of you is, if you've got a laptop with you, if you've got a notebook or a pad with you, or pen and pencil, keep that with you. And I would like you to engage with me as I speak. Start writing in those notebooks. I would like you to reflect on, as I reflect, and then those reflections of yours could be collated later. Then that becomes the point for further discussion. So don't just become a passive listener. Take your pen, take your notebook, and start writing as I take you through some of the slides. And please, may I request Dr. Mangaleswaran, please interrupt me if my voice is not clear, if I'm not sharing my points clearly across. So
Certainly.
that way, all right, so that's good. So are we ready to go now?
Yeah, fine.
Wonderful. Thank you. So thank you, Professor Ilango, for asking me to do this, and Dr. Mangaleswaran and all the team. Yeah. So I thought I'll just explain my background here, my context and my acknowledgement, because I need to acknowledge each of you who are listening to this, because you have taken your time, precious time, out of the things that you're doing and being here. So my background is, I'm a social worker. I'm really interested in understanding what is happening around us, right? And I'm here in Australia at the moment, but I'm deeply connected with my colleagues and friends and families and communities back home. So there is a strong connection for me to be here and talking about the Australia-India connections as well. So my background is again a social work, and I've been teaching here. Currently, I'm leading the team, and I will also share some of those things with you as we move forward. And you can see some of the books that we have published in collaboration with the BDU. I thought this is also an opportunity for us to celebrate the 10th year of BDU JSU collaboration. Of course, the official documentation came much later, but we started this collaboration way back in 2010. So I just want to acknowledge Professor Ilango's great work here, the research interests and collaborations and that we have done. So over this period, we have done some amazing work. So let me just take you through some of these things. Let's look at some of the pictures, a few ones. If you go to the next slide, please. Yeah, so this is the conference that we attended. My colleague, Dr. Noni Harris, who came and presented the GYAN project research workshops sometime, I think last year. Then we had a number of collaborative workshops and research seminars. So BDU and JSU has got a good friendship, good collaboration, and I think we are adding another feather to this particular activity. So Thank you, BDU, for being part of this journey. Okay. So now I want to invite all my listeners to this particular website, this particular slide here. Let me invite you all to reflect on your personal experience as to how COVID-19 has impacted your life. So please start reflecting in your own mind. Okay, how has it affected me as an individual, right? You might have a number of responses, how this has actually affected you personally. So for me, I am now in my house. I'm not able to go out. I can't talk to I cannot go and conduct face-to-face workshops or classes. So there are certain things that I am actually experiencing, not able to connect with other things. So I'm asking you to think about how this has impacted your life, how this has impacted your family, your neighborhood, your friends, your communities. And of course, once you have understood that, then move on to your own particular state from where you are listening. What is happening to your state, right? What is happening there? What are the policies? How people are managing? What is the government interventions there? Then move to your country, nationally. What is the national focus here? What is the national directive? And then look at from a global perspective, right? All right, so let's take so I would like you to just keep writing your responses as I speak, okay? I hope you're all doing that. Yep, please go to the next slide. Yeah, so I would like you to summarize this. In a way, we could say that all of us are affected. Whether I'm in Australia, you're in Germany, you're in India, we are all affected, isn't it? And the idea of uncertainty that prevails. Not sure what's going to happen next. And our fight to conquer the invisible virus continues, isn't it? The whole nation, the entire world is trying to find, some remedies for this. I think everybody's trying to find an answer to this. And I think please add your own individual reflections to this particular slide. So you will have gained some of your own personal references, personal reflection to this conversation. Next one. Okay, so here, in Australian context, our Prime Minister Scott Morrison says, stay home, save lives and save livelihoods. And medical direction has been very, very clear here that you need to maintain physical distance. You need to be staying at home, and that way we can save livelihoods. And so that particular question I want to ask, I think similar messages have also been stated in Indian context, that you need to be working from home, you need to stay home. And so staying home, has this affected us? Ask yourself that question. Has it affected you? In what ways it has affected us? Let us examine this, because these examples, these ideas will then take us to ask those big questions. So from a personal journey, and then looking at from a professional journey. That is what I would like you to listen to me. So from my point of view, loss of jobs, inadequate resources, access to care, new work models, domestic violence, racism, all these things are happening here, even in an Australian context. People have lost jobs. The economy is really failing. And you can see the increase of domestic violence. Even in Australian context, there has been some recent increase in the domestic violence. And the percentage of people who are seeking mental health assistance also has increased. So staying home, how has it affected Indian population or in your own community? Anxiety, because we do not have that control over things, isn't it? So therefore, this again puts us to think differently. So the impact. So what's the impact then? If this is you're struggling with, and what's the impact? So next slide. So what's the impact? The impact is very huge. It's very difficult to comprehend at the moment. What we know is that we are living through this situation, isn't it? This is the current environment. And in this current environment, we're all trying to do what we can. And the families, the individual members, even the society is actually struggling at the moment. So from a personal point of view, to a group and to the families, And now let me take you to look at and pay attention to our social work education, research, and practice. And I think my focus is on this particular task, but I thought it's good to begin to have that personal reflection from a personal point of view, from the state and national and global perspective. And now then we are looking at a professional point of view. Okay, so let's talk about social work education then. That's in the next slide. Let's talk about the social work education. Will this be, I think one before, will this be same? Ask yourself this question. See, I want you to engage with me in this kind of dialogue. Of course, we can't have it directly, so I want you to write an answer to this. Will the social work education be same? Should it be the same? If not, what needs to happen then? How can we make that happen? How do we develop one? And I think there is a scope here for each social work institution or a professional association to think about it. And I'm only sharing some of my thoughts here. And what are the challenges before us as professionals, as academics, as researchers? Right. So if you look at the next slide, this set of questions lead me to take you through this particular slide, going beyond the contemporary social work practice landscape. If you look at the COVID-19 pandemic has fundamentally challenged and changed social work education, research, and practice. And you all agree with me that, isn't it? Even the US, the programs have immediately gone into online platforms. Even in Australian context, we have gone on online. Again, in Indian context, it has gone online. The accrediting body has actually given us some relief in terms of reducing the hours. I think I can quote from US and from the Australia that the accrediting team has relieved in the form of reducing of field hours and for social work students. And you can see the conferences and meetings are now adopting virtual platforms. A new international research agenda related to managing and responding to pandemics has started to emerge. A number of academic journals have announced special issues focused on COVID-19. So the impact that the COVID-19 has and will continue to have on social work cannot be overstated. So therefore, my question here is about social work education. That is on the next slide. Yeah, online education. I think in a way people have embraced this, online education. But should it remain the way it is? What needs to happen? I think some of my students say, Abraham, we are zoomed out. We do have a zoomed out experience because they are always having these Zoom meetings. So now we're tired of, zoom in, zoom out, zoom in, zoom out. So would that be a phenomenon that we need to address? Right, relevance of concepts, what has worked and what hasn't worked. So as we start working in the sector, currently, are social workers in the front line? Are we providing that kind of a support to frontline needs? So the subjects, the content, the concepts that we have delivered over a period of years as Indian social work educators, is this really making sense now? That's my question. Is this really making relevance? Is it relevant here? Are we frontline workers? And how we have, as a profession, responded to COVID-19? I think we have to do a lot more reflective analysis here to see the relevance of the social work profession in addressing this crisis. In one way, I could say that COVID-19 has actually allowed us to have this more global connectedness. We are able to have this webinar, we are able to bring in more people, we share the resources, we share the understanding. Of course, this should have happened even before, but this particular issue has brought us in a short period of time. As technology has facilitated this visible relationship, as technology has facilitated this invisible relationship, what is the next question? Should it be visible, etc., etc.? So the question here is about access to communities. I'm calling it as a kind of a paradigm shift. As social workers, in India, we could go to any communities. We could freely enter into those communities because we need to have some community connections. And as social workers, we go into those communities. We ask our students to go. We establish good relationship. We establish partnership with them, and then begin to work with them, isn't it? That's one we have embraced community development activities in Indian context. But my question now is, are our communities experiencing of fear? Is the concept of community getting a little challenged? Because we can see now communities are trying to withdraw and look at a safety paradigm. Is it safe for me? Is it safe for our community to do this? And I think sometimes I think we have to reflect about the safety net, the safety of the community in terms of who is entering in where mechanism. Do we need to do a mandatory reporting? Do we need to do a health risk assessment? We need to do a collaborative action plan if things go wrong. It's a challenging thing that I'm asking, but I think we need to revisit some of the taken for granted notions of community approaches and to think about what is the future for us. Okay, so to guide us with this particular way of looking at, I think we need to look at the social work definition once again. So next slide. So if you look at the social work definition, we're talking about the principles of social justice and human rights. It is a practice-based profession, and then underpinned by theories of social work and social sciences and humanities and indigenous knowledge. Now, that's where the question is, are we really using the indigenous knowledge, understanding, respecting, valuing the local wisdom of the community to work with our communities, isn't it? And to help us with that, I think maybe look at the work that we have been doing so far. Look at the critical social work theories. The book that I have mentioned here actually talks about how we can embrace a critical social work approach to what we do. And I do not have enough time to go through that, but I'm only sharing that, while we kind of revisit and look at the kind of work that we do, the critical social work approaches might actually help us in that direction. So what's happening at the moment in our Indian communities? So let me just give you a few examples that I kind of observed from Australia. So next slide, please. One thing, again, this I mentioned in one of the other conferences that I attended, the unorganized workforce, both nationally and internationally. Look at, I am a migrant here. So the Indians who are at the moment in Australia, they cannot get back to India, although they want to go back to India. The workers in the Middle East, the laborers, they want to get back to India. Now there are some flights that are being organized. So I think this is important to look at what could be our role in this unorganized sector. The fleeing population, migration and people's movements, access to treatment and care, who can access? People who have lost their jobs, and I think that's the scenario in the Indian context, even in the Australian context. Even in the education sector, higher education sector, people are losing jobs. And of course, this has a particular impact on women and children. So who is their voice? What is our role? And I'm sure we are all playing our role. I'm not saying that we are not doing. I'm only saying how we can take this agenda forward so we can be more informed about the kind of work that we did. What are some of the theories? What are some of the approaches that helped us to get through this crisis? And keep that assessment and evaluations on so that we can learn from this and then move on to developing our creative ways of engaging with our students in addressing some of the challenges that even we might face during and post-COVID era. So therefore, the next slide is something that I want to openly share with you. Remember to look up at the stars and not down at your feet. Try to make sense of what you see around and wonder about what makes the universe exist. Be curious, and however difficult life may seem, there is always something you can do and succeed at. It matters that you don't just give up. So my dear students, colleagues and friends, let's not give up. Let's see the stars. Let's look up and see what are the opportunities for us here. And I think I did speak about pandemic versus possibilities. Pandemic, we are describing this as pandemic, isn't it? So in terms of looking this as a possibility, what can we do? How we can support? So therefore, I have a vision to share with you that is about the head, heart, and hand. I'm just trying to locate that particular extra thing. Yes, I think this is a good opportunity for social work profession to strengthen the science behind social work and explore more in detail about the art behind helping. This will provide more opportunities for local practitioners, academics, and researchers to come up with the locally suited, culturally appropriate, indigenous models of practice. And this must be done through collaborative engagement and partnership. Let the need dictate what needs to happen. And I think we know some of the needs, but are we ready to respond? So this exercise then leads me to think about the models of intervention that we can use in our practice. And I think it's one of the challenges that we face in our practice today is, I think I can't see the slides. I'm just timed out. Sorry, I'll come back to this. Yeah, okay, sorry. Yeah, all right, okay. So it's about what should be our approach? Yeah, what should be our approach? And I think it should be about creative ways to move forward. Those students who are listening to me, I ask you this question. What are some of the creative ways that we can address some of the challenges, some of the issues that we are facing? And we need to recognize the leadership that our students are demonstrating, our practitioners are demonstrating in the sector. And that needs to be documented, that needs to be shared. That's very important. I think that my slides have gone from the screen. So creative, yes?
It's there.
I can't see it myself anyway. So I can't see my slides, but yeah. Can I go ahead?
Yeah, please, sir.
Yeah, so I think we need to be looking forward. And this approach should be ethical, responsible, and rational, because the future is unknown. And I think we need to embrace technology as a necessary tool for our practice. Very often people say business as usual. I think it is not, and it will not be sufficient. So therefore, we have to go beyond that paradigm. I think the slides are not available. I think what is important, the slides are not appearing for others as well.
Oh.
Hello?
The slides are not visible. That's what they're saying. Okay, moving to the slides.
Yeah, the slides are not seen.
It's visible.
Yes, sir. Visible?
Yeah, we have to pin it.
Yeah.
All right, I think it appears in a different slide. So if you could pin it, it will come to the main screen. Yeah.
Okay.
All right, so let me move. So therefore, we need to anticipate.
Yeah.
Okay, I think what we need to do is we need to anticipate what is yet to come. Okay, and I think that's why I say we need to be creative and look at this pandemic versus possibility. So in this process, what then needs to happen is we need to be guided. We need to be supported. I'm talking in the context of students and practitioners working in the sector. We need to provide them with supportive mechanisms. And one of the things that I see here is about supervision. So Australian Association of Social Work, it talks about supervision as a forum for reflection and learning. It's an interactive dialogue between two people. And I think supervision as a process, it should be made available to our students. and our practitioners. Something that needs to be strengthened in our thinking. And again, adding value to those supervision is about that critical thinking which I talked about, the critical social work ideology that I talked about. We need to also bring that into our current context of discussion and to include reflective supervision. And as a profession, moving forward, social workers require critical thinking, clear ethical codes, values, and skills in order to change society for the better. And I think this is an important message for us to embrace, if it is possible, to organize reflective supervision. So the professional curiosity, the next one is about, I talked about the head, heart, hand, and the professional curiosity. What am I doing? How am I doing? Is there anything that I need to do? Is there anything that I need to unpack? And why things are happening the way it is? So those of you who are making notes, ask this question to yourself. How am I doing? What am I doing? Is there anything that I'm not understanding? And in that context, the blind spot approach, checking your blind spot is going to help you. And that's what the supervision is all about. And therefore, a couple of slides that actually talks about the importance of professional curiosity. So at the moment, there are so many things that are happening around us. So I think what I'm suggesting here is apply this curiosity mind, apply this curiosity approach to explore as to what is happening. And a couple of examples that are highlighted through these slides, the social workers in the UK who have applied this methodology, they have come up with some research evidence to suggest that, yes, this is really, becoming an important thing, right? And I want to highlight an important reference here. Those of you are using, Google and, other search engines, please look at Dr. Richard Hill, who actually talked about, he's one of my friends and a colleague who has been working in this particular space about looking at and understanding and developing ideas around curiosity and how curiosity can be applied in practice. So in conversation with Dr. Richard Hill, we've come up with something. Dr. Richard has actually talked about this curiosity approach. So those of you are interested can look at this curiosity approach. And when people say that, things are happening, I think we ignite ourselves. We ignite our interest, fascination, and wonder. So for academics, when your students come and say, so and so has done this work in the field, or a student says, my community member has done this work, we might wonder at, marvel at, and say how wonderful it is, isn't it? So the catchphrase here is, that is so interesting. But I think let's not stop the conversation there. Ask your student, ask the practitioners, tell us more about what is it that makes this conversation or this issue as so interesting for you. So you're able to unpack that and go beyond that particular statement of interesting. So that curiosity approach actually allows us to move beyond. So there are a couple of stages, stage 1, stage 2. And how much time do I have, Dr. Mangaleshwaran?
Yeah, you can go, sir, no problem. Yeah.
Okay. So that's one thing I want to stress here. Again, using that curiosity approach. The first stage is, yes, that is interesting. It's good, isn't it? Many of you said, this conference, this webinar is so interesting. And we could be just satisfied with that, isn't it? But if you want to ask that question again, what is it that this webinar is so interesting? What are the elements? Why is it so? And then you get so many answers to that. And that will only happen when you are curious to know that. So, for example, what is happening with this pandemic in your community? What is happening to the group members? And when you ask those questions, you will get a lot of answers. And I think that also needs to be done with a critical lens, not just buying into everything that has been presented. Okay. The second stage is the curiosity approach. Stage 2 is to search for what lies beneath the surface issue, that emergent property, and discover what this is really all about. And here the catchphrase is, what is the message in this problem? And the third phase is about creatively explore the new realizations that you've achieved and how they might make it possible to reintegrate both within and without. This catchphrase here is, what can I create from this? And of course, it takes longer time for me to expand and explain this, but I'm only giving little bits and here. But if you're interested, you could go more into that. So the curiosity approach, stage 4, is gently explore how the realizations, resolutions, and creative discoveries can be integrated into the self for professional growth, health, and ongoing well-being. So curiosity can also be kind of used as a source of inspiration and also as a matter of looking after ourselves as a well-being concept. And the catchphrase here is, how do I make this part of my life? And of course, that leads me to talk about what is the positive future for social work. The next slide, the positive future for social work. Okay, many of you would be thinking, what is the future for us? And I think the point here is being present. And that is what a social worker's gift. And I have also used this from a website, which I thought was quite powerful. So I have provided some references there. I think engage in positive discussions. Engage in positive interactions. Engage in positive engagements. And we need emotionally resilient social workers. That way, that leads to talk about how are we visible? The visibility of our profession. What is happening? How media is actually talking about us. The visibility of the profession. And I think this is a time that you may have seen some of the things that are coming through the media around the kind of work that social work professionals have been doing in the country and around the world. So for me, some of the recommendations here, and one of them is revisit the pedagogical approach to teaching. How can we revisit the approaches that we have been using? The face-to-face models, the classroom instructions, the field placements, the rural camps, all those things. We need to revisit them and to see whether are we responding to the real needs of the issue at the moment. The thing that, again, I want to reiterate this, are the methods that we are teaching now, are they really relevant in the context of our practice? Do we really need to go a step beyond to embrace few more things, or do we need to strengthen the existing models with some of the lessons that we have learned from the current issues that we are facing? Then, are we really relevant in responding to the needs? Do we need more skills? Do we need to develop more indigenous strategies to address social problems? One of the things is about revisiting the placements, field placements. So let me share my example from Australia here. So as a head of the academic group, we have been talking about, how can we address the placement issues. Students have to go on placements, and the students have to finish 1,000 hours of field education as part of the accrediting body's requirement. So in the first semester, we had to call these placements off because that was not an appropriate thing for students to be on doing the placement. So we stopped the face-to-face placement. We tried to organize an e-placement where students are still connected with the agency, still connected with the community, still connected with the academia, but then they are not having any face-to-face, no face-to-face interactions. So that particular model is working for us at the moment, the e-placement model. So we need to see whether we need to do a kind of an evaluation and to see whether that would be an approach that we want to adopt for our program. Of course, we do have an online presence with our course, the online engagement, collaborative sessions. We regularly engage with our students through collaborative sessions. And then at the moment, I'm involved in developing e-assessments and feedback mechanisms. When I say e-assessments, the students are not to write any examinations. They can just submit the assignments, and trying to develop whether we can come up with an e-assessment model. That's the direction that we are taking at the moment. So I'm only just sharing some of the things that I do here as well. and a strong emphasis on social work and mental health education. I think very important point here. I think it's very important that we need to increase the volume of content in the social work and mental health subject and curriculum. We need to expand that and to look at how we are preparing our students to become frontline workers. Are our students able to get that interdisciplinary knowledge to work in a multidisciplinary team? So if they have to work with a doctor or a nurse or an occupational therapy nurses, are our students equipped with that particular knowledge base so that they can easily engage in that multidisciplinary conversations? So I think there needs to be some kind of a discussion on a national level to look at the mental health social work education curriculum, and also introduce, as I think the Dr. Gopinath mentioned about the self-care strategy. I strongly feel that we need to look after our students. We need to look after our community. We need to look after our practitioners. Self-care strategy. Self-care needs to be used as a kind of a subject within the social work curriculum, so that students are trained to look after themselves in the event of any eventualities, in the event of facing difficult situations. They have learned the skills of taking care of themselves. And I think we need to, I'm sure that some of the universities are already doing this kind of work. If not, I think there may be some special consideration given to looking at this. Approach research with the sensitivity. And I think this is very important, very crucial at this stage. I think many universities and organizations are trying to engage in research activities. I think my response here is, I think we need to do it with a great deal of respect in understanding people's lives. Approach the research with the sensitivity, with an ethical framework approved by your university or organization. And I think ethical, approval, ethical permission, I think that's a very important thing, especially as we move into the post-COVID era of research and practice. Again, promoting interdisciplinary education and add more content about public health and skills for being frontline workers. Some of the feedback things that I have been receiving are in relation to our social work professionals or social work students' skills in engaging with. I must say, our students are so fabulous, fantastic. They are really doing a great job. But I think sometimes they need some extra support in getting them skilled enough so that they can move on with those kind of a work in a collaborative and a multidisciplinary context of practice. So these are some of my reflections and thoughts that I thought I need to share with you as we continue to debate and discuss about the social work education post-COVID. I have given a kind of a broad picture, taking you through a number of slides, from individual reflections to groups and communities, and also from the profession, giving you some kind of an approach to practice, developing a curious mind, understanding the head, heart, hand approach, and taking a positive attitude, being mindful of what is happening around us, and taking that positive spirit, the strengths-based approach, that we are not seeing the deficit, but we are able to see the positives, we are able to see the strengths and move forward, and embracing curiosity as an approach to our practice and engagement. So, I might say, I have no special talents. Says Albert Einstein. That's what he said. I am only passionately curious. So I request all the students who are listening, just become a bit more curious and unpack the stage that I talked about, stage 1, stage 2, 3, 4, and to try to unpack and see what is the message that you are able to get out of it. So therefore, my message from this discussion is, the next slide is demonstrate our professional identity and relevance. This is a time, I think, we need to be really demonstrating our professional identity. Students, practitioners, academics, write as much as you can. Share as much as you can to the common people about the kind of work that you do. The visibility of the profession is to be, showcased, and the kind of the good work that you do. The second one is about, the visibility. The third one is proactive engagement in working with various stakeholders. be involved, be sharing the information with the different stakeholders. Professional leadership to engage in providing direction and advice and plans. And of course, critical analysis and suggesting action points. So we are social workers, but with a critical framework. That doesn't mean that we are only providing critics and critic analysis. No, what I'm suggesting here is we are able to see what is happening with some element of curiosity, able to unpack it and analyze it with a critical approach and provide an alternative response. Not just providing problems, but I think coming with a solution, a solution-focused approach is an important element to consider. And of course, we need to provide a blind spot analysis for, maybe for policymakers, for even your panchayats or communities or your local governments. So I think as social workers, if you're able to embrace some of these aspects and make it more relevant, so these are practice-based suggestions that I'm saying. Currently, these are the things that we can do, and this needs to be documented, shared, and then we can move further on. So just give me the time limit so I can accordingly manage.
Yes, sir. Yes, sir. You can just. I think we are
Control?
near. Yeah. Yes, sir. Yes. Sir.
All right. Okay.
Yeah, you can.
I'm just looking at some of my earlier notes.
Yes,
Yeah.
no problem.
Yeah.
You can just
And
go
I
from-
think yes.
Yeah.
I think we must remain a still and settled mind as social workers. That orientates us to engage mindfully with our strength and resilience. We also need to trust that when we are calm, grounded, and connected to people through our engagement process, I used to call it as heartfelt interventions will arise. There is all the more a need to revisit the head, heart, hand approach to our practice. This strength-based perspective provides a foundation for us to enter the unknown together with the people whom we are working with. Let us use all our skills, such as crisis intervention skills, listening skills, advocacy skills, negotiation skills, to prioritize needs and support people who are at the greatest risk and most vulnerable during this time. Let us visualize and dream about moving forward to developing a more just and compassionate society. And let us play our role as agents of change. And that leads me to kind of the last slide, which I actually read the recent publication, kind of a write-up by Arundhati Roy. And I just want to quote her here. It is in the slide presentation as well. Historically, and this was actually shared online on the 1st of April 2020. And the name of that particular article is The Pandemic is a Portal, from Financial Times. And when I went through that particular article, the last sentence was quite interesting for me. And I thought I want to share that with you. Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between the world and the next. We can choose to walk through it, dragging our carcasses of our prejudice and hatred, or our hours, our data banks, and dead ideas, and our dead rivers and smoky skies behind us. Or, that's where I thought I want your attention. Or, we can walk through lightly, with a little luggage, ready to imagine another world, and ready to fight for it. And I think that's a very powerful sentence for us as professionals. Are we ready to imagine a new social work agenda for social work profession in India? Are we able to imagine that? Is Bharathidasan ready to take this up and move forward I just heard your registrar saying this particular sentence. The university motto is to create a new brave world. Is that correct?
Yeah.
Yeah, and I think it really aligns, isn't it? The what Arundhati Roy is saying is that we can walk through lightly with a light, little luggage, but reimagine a new world. And Bharathidasan again here has a mandate to creating a new world, new brave world. And I think here there is an opportunity, not a pandemic, isn't it? So this pandemic has caused one of the largest paradigm shifts in social work education, research, and practice in history. And we must adapt in ways that align with the social work values. And I think the next one. I think I just mentioned this earlier in my slide. I said we just need to be present. If you can see the last slide, just be present and just observe. And through those observations, we learn so many things. So before just concluding, one more comment and I stop here. I have really, tried to share some of my thoughts with you. These thoughts were some of the things that I have been thinking for quite a few days, and I'm still struggling to find answer to some of the challenging questions that I posed before you. I do not expect an immediate response. I do not expect you to find an immediate answer. But these are conversations. Let us create the small groups. Let us create groups of people who are interested in taking up this agenda further and talk about it. And because by creating this collaborative network and partnerships, I think we are going to really, create some kind of changes, because we believe we can change and we can make changes, because as Mahatma Gandhi said, be the change that you want to see in the world. And I hope you're all going to take this up as an important thing for our career. And let social work professionals be out there. Let's celebrate the kind of work that we do. Let's appreciate one another. Let us thank one another, and let us create opportunities and create avenues for our students to demonstrate those leaderships. And academics, please provide more supportive ideas and opportunities for our students to excel. And practitioners, you are doing a great job. Students, wonderful to have you here. My colleagues who have been listening to me, thank you so much for hearing me. Thank you so much. And I stop here. Thank you.
Thank you, sir. Thank you. That's really a scintillating and powerful speech on the reflections of social work. You really started very well with the personal reflection. That is right from the micro to macro level, how the social work education has to be, the vision, the challenges, how we are being globally connected. And as you rightly said, there is a paradigm shift in the education system as of social work. As Bharathidasan said, we will create a brave new world. And of course, we are also trying to create ourselves with a new world. That's what we brought here for the virtual platform, like e-assessment. Even we are also involved in the, as you said, e-placement. Even we are trying to look at the students for a interview over online. Even the test is being conducted online for the placement. And as you said, now the system is zoom in and zoom out. And we in Indian and as our Bharat University contacts, we say that Google Meet in and Google Meet out. So, so that way. So thank you, sir. Now we have few questions which appeared in the chat box, sir. So just I'm not able to get the chat box, and few questions are there for you, Professor Abraham, to reflect on one or two things which you can just address, sir.
All right, thank you.
There is one question, sir. Just elaborate on e-placement, how communities are connected.
Okay, so when I talk about communities from an Australian context, you need to understand. Can you all hear me okay?
Yeah, fine, sir, fine.
Okay. So we need to understand the community from a different cultural context, from a geographical context, and from a from a professional point of view, right? So we cannot imagine a community just like that we have in India. So when I talk about a community here, I'm talking about a community of practice. That may be a group of people working in the community sector. So a community development officer, maybe a project manager, a community representative, but they are all working from home, but still creating a community of practice.
Yes, sir.
But not necessarily going and visiting a community.
Yeah, yes, sir. There is another interesting question. So what kind of additional skills do a professional social worker need to acquire in post-COVID-19 scenario?
Yeah. I think that is a wonderful question. Whoever has asked that question, I would like that particular person who has asked that question to reflect on it. What do you think? I think that's very important. What do you think is important? And then of course I can share some of my ideas. So thank you for that question.
Yeah.
And what I see is the world is not going to be the same as we. Can you all hear me?
Yeah, fine, sir. Yes, sir.
Okay. I think we need to plan for a world that is uncertain. We need to look for opportunities to engage with uncertainty. So the first question is, are we really preparing our students to address uncertainty? Because uncertainty is always going to cause anxiety, isn't it? So are we training our students to manage those anxiety first? If our practitioners are able to manage their own anxiety, then they can just walk into any uncertain context of practice and deliver. So that is one thing. The second thing is, so again, self-care skills, very important. Managing one's emotions, very important. And then developing professional boundaries. I did mention about this some time back. How do we maintain professional boundaries? So that we are able to really understand, what our position is. So ethical practices. We are not just entering and doing something. I think I used 3 words: being ethical, rational, and one more word. Ethical, rational. I forgot that word. Yep. I think we need to be ethical practitioners, isn't it?
Yeah.
And rational. Yeah. So it has to be there has to be logic. So I think it's skill based. Our interpersonal skills needs to be strengthened. Interprofessional knowledge. And the other one is, ask yourself this question: am I really prepared to walk into a crisis and able to manage? What will help you there? So, for example, if you are asked to manage a healthcare program in your area of residence, will you be able to manage that? What kind of skills you need? Maybe this is a workshop topic for the students. What are the skills that you need to work in a crisis management situation? For example, if you are now sent to a COVID crisis management center, what kind of role you can play there? What are the skills that you would need? Personally, professionally, and are you able to engage? So I think these are some of the questions that I might begin to kind of check and ask. I think I always use 3 words. We need to be competent in whatever we do. Okay? And our competency comes from many ways, from our education, from our exposure, from our interactions, from our travel, from our reading. We need those things to make us ourselves as competent workers. We also need confident workers. Workers who are confident about their skills, they're confident about their knowledge base, and professionally articulate their position in a multidisciplinary team. Right? So competence, they're able to be saying things in a confident way. And of course, we need compassionate people who are able to understand, who are able to empathize, who are able to relate to them and yet provide a wonderful service. That's why I said head, heart, and hand. And simply put it, competence, confidence, and compassion. And I put it in those words. But in real essence, we need our professionals to be engaging in meaningful, engaging way with our clients, with our communities. So it is not about showing professional arrogance. It is not about showcasing your knowledge. But I think those knowledge, those skills that you have attained over a period of your life, over a period of your education, that you're going to transfer in your interaction, in your engagement with the communities. So therefore, you are able to work well with the community and achieve that social justice and human rights. So you become the voice of those voiceless. You become the hope of those people who may not have hope. So in that way, you create change in the sector, in any context that you are going to work. So I would stop here asking, might give more chance to ask other questions. Thank you.
Yes, sir. There is another question.
Yeah.
Of course, this is related to NGOs.
Yeah.
The NGOs are demand of funds to support their stakeholders. There are people struggling due to lockdown situation. How social workers can help and mobilize fund to help people? Of course, this is related to NGO of mobilizing the funds. So that is what I think it is related to community development. They are asking how to mobilize the fund, the situation.
So what is the question? What was the last bit?
How social workers can help and mobilize funds to help people.
Okay. So I think resource mobilization, that's the point here, isn't it?
Yeah, that's what they are trying to say. Yeah. Ask.
I think finding funds is always a problem, whether it is pre-COVID or during COVID or post-COVID, isn't it?
Yeah.
But what I have seen is if the cause is really articulated well, if the cause is properly discussed with a clear outcome defined, the readers are going to embrace it. So I think that's again the skill that I was talking about. Are we able to provide such a comprehensive scientific approach to our funding appeals? Just asking for, I need 1 lakh rupee is not going to be sufficient, isn't it?
Yeah.
I think as professionals, we are able to professionally or scientifically, I use the word scientifically, discuss the importance of the topic, importance of the need, and highlight how this is going to, change the lives of people. And I think if you're able to show that link between what is the current situation, what is expected, and with a clear outcomes mentioned, I think there are avenues where you can, get funding. Let me give you an example here from an Australian context where I'm talking now. So we have nearly, some Indian families here. When Kerala was, affected by the floods, some of the young children, nobody asked them to do it. Some of the young girls got together. They just organized a dinner night, just asking people to come and join a dinner. That way, they were able to bring a lot of communities from other, sections of the society. There were Italians, Germans, local Indians, local Australians. All these people came together and they organized this, program. And of course, it was also part of the association and they supported that. But they were able to mobilize some funds. So it was a locally driven kind of an agenda to support people back home. And probably think about creating some kind of a network with people who are interested in promoting this idea. So developing an idea, finding a good partnership, and then working with that partnership. It's only through partnerships and collaborations that works. For example, just an example, we, Professor Ilango and myself, we have been working for the last 10 years. Is it correct, sir? More than 10 years. But it's just one telephone call that we are able to sort out this. Is that all right? I only got 1 day notice for this, maybe 2 days. Is it? So I think it's always the relationship. So as practitioners, my advice would be to develop relationship, authentic relationship, not just for the namesake. Develop authentic relationship, authentic applications, and that authenticity will lead you to clear, successful outcomes.
Thank you, sir. Thank you for, answering all the queries, sir. Now, may I request Dr. P. Ilango, the senior faculty and a professor of our department and the syndicate member of Bharathidasan University to give a concluding remarks. So, over to you, sir.
Thank you very much, Dr. Mangleshwaran. And at the outset, let me thank my great friend and colleague, Associate Professor Dr. Abraham Francis, for the wonderful lecture on the topic of this webinar. With his rich experience and also insightful thoughts and reflections, and his long period of engagement with strengths perspective and also mindfulness and other important areas. So it was wonderful listening to you, Abraham sir, and you covered the entire spectrum of social work education. I think right from pedagogy to placements and assessment and international or departmental collaboration or interactions. I think the whole spectrum of social work education related issues have been addressed by you so well, and in all your answers to the participants' questions, I could see deep reflection of your thoughts. I mean, very reflective thoughts and critical analysis of what is happening in the professional scenario of social work in India and in Australia and maybe even around the world. I just would like to highlight some of the key points which Dr. Abraham mentioned, which really are so crucial for taking our profession to the next level in our country. I think this webinar should really motivate our social workers around the country, whether you are practitioners or students or researchers or
your sound is breaking, sir. Your voice is breaking. Hello. So your voice is breaking. Hello.
Can you
Sir,
hear
your
me
voice
now?
is breaking, sir. Your voice is getting.
1 second. Can you hear me now?
Yeah.
Can you hear
Please.
me now?
Yeah, it's little bit low voices.
Yeah.
Please.
Sorry about that. Some
No problem.
problem with the
Please
network. Yeah.
Please.
So as I said, I think as members of the social work fraternity in India, particularly, I would like to appeal to our participants who are from India, social work students or teachers or administrators or whatever may be your designation or cadre. I think all of us need to take these important suggestions given by Dr. Abraham Francis, which I think will take our profession to the higher level, for recognition and proper public, for getting its authenticity. I like the word authenticity, which Dr. Abraham used. I think whatever we do has to be authentic. So it starts with self-reflections as a professional fraternity. Professor Abraham Francis talked about reflections at individual level, family level, community level, government level, or international level, global level. And I think as social work fraternity around the world, and also as social work fraternity in India, as a collective body, we need to involve ourselves in an introspective self-reflection, collective self-reflection, and look at the blind spots. Again, I'm using Dr. Abraham Francis' words, the blind spots in our profession. We all know the Johari window. The problem with that is, with the profession also, there is a blind spot which we do not understand, we do not know, and probably others also do not know. We have to explore. We need to do a lot of introspection, and we need to engage in dialogues with other fellow professionals from around the country and around the world, and see where the pitfalls are in our profession or in social work education and practice and research. And also the other aspect which Dr. Abraham Francis talked about is so crucial. Dr. Abraham talked about this aspect of curiosity, which is also stressed by the famous, scientist Dr. Stephen Hawking and Albert Einstein. The curiosity, the willingness to learn, the interest in what is going on around us. That is an extremely important quality of a social worker. I think with these words, I will conclude by saying, using again Dr. Abraham Francis' words, we need to really look at our head, heart, and soul, head, heart, and hands of social work practice, education, and research. And I would add one more dimension to it: soul. Let's also look into our souls from a spiritual point of view. As you all know, even the health definition includes spiritual dimension. I think even in the profession, we need to add that dimension. We have to have our head, heart, and hands, and the soul. So with these words, I would like to once again thank Dr. Abraham Francis for his wonderful lecture. Thank you so much, sir, and thank you, Mangleshwaran, for this opportunity.
So really, I hope that the participants have really enriched and enlightened with the thoughts of Dr. Abraham and the concluding part of Dr. Ilango. And we had a very, what's a reflection about ourselves. As rightly pointed out by Abraham, we need to look into right from the micro to macro level, and how about taking forward our profession is very important. As both of us said, the curiosity is very important, and I hope that we are all curious to look into the tomorrow session also. So what kind of curiosity, with this curiosity, let us conclude the session. And I wholeheartedly thank Professor Abraham sir for just sparing your valuable time from Australia, and spending your inputs through your reflection and your thought-provoking lectures. I would say not even a lecture; it is your ideas that has really made the social workers, practitioners, students, and each every one of us to just rethink. That's what I would say, that rethink about the social work curriculum, and how about in the post-COVID situation, how we are going to take forward our profession. So that is a great challenges for us. So thank you very much, each one of us who are present here. So thank you, sir. Thank you, each one of us, for joining us, and meet you again with same curiosity, and catch up tomorrow afternoon by 2 by Indian Standard Time. Thank you very much.
Thank you.
Thank you, sir.
Thank you, Abraham, sir.
Thank you, sir. Thank you,
so
sir.
much.
I'll talk to
So,
you. Thank you.
so thank you, sir. Thank you, Abraham, sir. So, sir,
Thank you, Judith.
session. Thank you, sir.
Thank you. That's lovely to see you.
Yes, sir. Yes, sir. Okay. Thank you so much, sir.
That's wonderful. I think there are a number of students here, isn't it? A couple of,
Yes.
lot of students.
Yes,
Yes.
a lot of
Almost 1,800 people have registered. Nice to
Yes.
see you, Bhaskar.
yes.
Oh, lovely. So that's wonderful.
And it is
I don't-
gone on YouTube, sir.
1,800 registration.
It is
Some of
gone
them
on
are
YouTube also.
on YouTube also, live through live also.
Okay. Oh, that's good.
Yes, sir. So really, thank you, sir.
All right. I'll give you a call.
Yes,
I'll
thank
call
you
you.
so much.
So I will.
கரெக்டா என்னன்னு உங்களோட சொல்லு. லேப்ல ஒய்ஃபை ஆன் பண்ணிட்டியா?